when did Rush, I mean, COVID-19 was not your impetus to start virtual care and on-demand care. When
That's
did this
correct.
planning start and when was it officially available in the market?
Yeah, the planning probably started around, say, 2.5 years ago. And those asynchronous visits that I referred to have been available for about the past year and a half as a resource that was available to the market, treating about sort of 15 to 18 different kinds of low acuity issues that people go online and get care for. And we had been building to a video program as well to connect people with video visits. And that had really launched probably about September of last year.
Okay.
Fantastic. As a part of that planning process, who were some of the folks that were part of your team? Like who's really in the room thinking through that process?
Yeah, it was people in our Ambulatory Transformation Center who were part of it. It was sitting down together with our information technology folks who really were people who had said, video and engagement with people is a primary issue for us, had been leading the build of our Rush app and had been leading the build of infrastructure to support video care as well. And then really our marketing communications and strategy folks were sort of the other leg of the tripod, if you will, really looking at this and thinking about how we presented to the public, right? So on one hand, we think all the time about services that we present to our patients, but this was also really thinking about how can we connect with the broader consumer population and really let them know that Rush is an extremely convenient place to connect to. And as we connected to them, also let them know about just all the different array of resources that are available through Rush, whether you need to see a primary care provider or you have other health kinds of issues. We have all sorts of ways to connect you, all sorts of locations to get you care.
Yeah. So when you guys were doing this planning, can you describe what you were hoping would be the ideal experience? Like what would be the ideal flow of a patient initiating a virtual care visit, going through to getting treatment or getting it resolved?
Yeah. So as we had this conversation, the perspective was always we wanted this experience to be a very friction-free experience from a patient's perspective, right, as they were going through this. And that runs into all sorts of bumps along the way in the healthcare environment because we're environments, oftentimes for very good reasons, maybe not always for very good reasons, but often for very good reasons, we have friction in our environment. We're very careful with patient information, right, as a regular thing for us. And there's very good reasons why we do that. And it's something that sort of competes with the let's get you quick, easy access sorts of stuff in there. So that's a piece that is always sort of a piece that we're working on is what's the right way to be very thoughtful about giving people access that works for them. They get connected to care. Time matters in this, right? We want to be able to get people care quickly. From the very beginning, we really set targets about care. When we talked about those asynchronous visits, they're visits where a patient will go in and if they said they wanted to do a visit for a cough, they would answer a series about 40 questions that has to do with cough. And some of them might ask them about a fever and there's a certain level, or if they have a fever over a certain level, we tell them, you're probably not right for you to be getting virtual care right now, but we can get you connected to an in-person visit. As they go through those questions there, they answer them and those all go to a provider. We set a standard that said our goal is that that patient has a response back in their inbox within 20 minutes, right? We sort of created a service standard to the public of an hour. But we said our internal standard is we want you to be surprised and get it back in 20 minutes and have a really neat experience. And that timeliness, much more so even than like how pretty the site is and the information is, for us was a real hallmark of what we were trying to drive on. Not that we didn't try and make it pretty and look good and present well as well, but that timeliness from a consumer's perspective, we felt was really key to what we were doing.
I'm so glad you admitted that because I didn't know if I could say that on camera, but when I called to be tested for COVID-19, they said, oh, it's going to take a couple days to get the results. And I understand that's the communication to the public, but it was actually same day.
Yeah, that's terrific.
And I think that's sort of, okay, we're going to tell her this just to set expectations, but really we know we could do this same day. And I really appreciated that because it was Friday. So I didn't know what it was going to be like for the weekend.
Because you didn't know whether 1 or 2 days meant Saturday and Sunday or Monday and Tuesday, right?
Yeah, exactly. But they were like, pull over, we'll be back in 30 minutes. And one comment about creating a friction-free experience, I think the best gauge for my family of knowing that you guys have done that successfully is that I actually am no longer the primary healthcare decision maker in my household. My husband does it because it's very easy for him to use the app. It's very easy for him to log on to the video. He's actually the one that got my primary care physician on the video visit for me to describe my symptoms.
Wonderful.
So kudos to that for that.
Yeah, for sure. there's complexity in there and trying to make an easy way for you to get access to providers. And at the same time, we're very protective of the fact that it's connected to your healthcare information, right? And so, we have to sort of manage through those two dynamics on a regular basis. And it's one of the things that in this environment, it's one of the things that in some ways is an advantage for healthcare systems, but in other ways, a disadvantage for a healthcare system. If we didn't have any of your healthcare information, in some ways, we could maybe even more easily connect to you, right? Because we wouldn't be so worried about being very protective of that patient information.